A conversation circulating on Chinese social media platforms recently says China is selling donated aid supplies to the U.S. China donated hundreds of thousands of rapid COVID-19 test kits to the Czech Republic, but Czech authorities said the kits weren't donated and had an 80% error rate. A Chinese doctor recounts witnessing a patient killed inside the ICU. He said the patient's death was caused by the Chinese healthcare system. And G7 countries meeting by teleconference today. Top of the agenda included combating the CCP virus and the Chinese regime's disinformation campaign. Welcome to China in Focus. I'm Tiffany Meyer. A blogger who became famous for her daily diary on the situation in Wuhan has published her last article. Fang wrote 60 articles during Wuhan's 62-day lockdown. But when the lockdown ended, so did her diary. In her final article, she urged Chinese authorities to hold people accountable. She says Wuhan citizens who witnessed the tragic events unfolding have the obligation to uphold justice for those who died unjustly during the epidemic. In her last article, she also criticized the extreme leftist power in China, saying it's like the virus infecting Chinese society and bringing disaster to the country. She said despite it being her last article, her Weibo account will remain open. She added she wouldn't give up. She ended her article with a verse from the New Testament and said support from her readers meant she never felt alone. Chinese real estate tycoon Ren Jianxin, who had been vocal in his criticism of Chinese leader Xi Jinping, has been missing since March 12th. His friend said he was taken away by authorities on that day. His son and his secretary were also arrested. Insiders say Ren's case is considered serious by Chinese authorities. Even his good friend, the Chinese vice president, can't help him. In an article about the current epidemic in China, Ren described a clown who insists on being emperor even though he isn't wearing any clothes. He hinted at Xi Jinping. He also criticized the Chinese Communist Party's suppression of the media, saying the censorship has allowed people to get hurt by the virus and the political system. Netizens began retweeting a video of Ren's speech at Beijing University in 2012. In this speech, he described the political system in China as rotten to the core. He appealed to students to tear down the wall and establish democracy in China.
在中国的现状情况下，我们唯一的社会责任就是在座的所有各位，你们努力地站起来，把我们面前墙推倒，建立我们社会民主制度。
Chinese state media recently reported on China donating rapid test kits to the Czech Republic. But it turns out the Czech Republic actually paid for the kits, and they didn't even work. Chinese state-run media reported on March 18th that China donated 150,000 portable rapid COVID-19 test kits to the Czech Republic. But according to a report by expats, the Czech Foreign Ministry paid more than $500,000 for the kits. The Czech Republic's regional hygienist said the test kits had an error rate of 80%. They only discovered the problem after sending samples to their lab for a second option. The results of the rapid testing kit showed both false positive and false negative results. It will now only do its own lab testing, which is limited to around 900 a day. A recent leak on the Chinese social media platform discovered that some aid materials donated by the Chinese Americans to Wuhan are sold back to the U.S. NTD Xu Wenrong has more.
There's discussion on Twitter over whether aid supplies donated from the U.S. to China were actually sold back to the U.S. On March 23rd, a screenshot of a WeChat group titled "Helping the American Hospitals" was discovered. One user is trying to sell boxes of protective clothing. The buyer notices the boxes are labeled, "China, you got this," and asks if those boxes were originally donations. The seller claims they were shipped to China by her friend in the U.S. The buyer doubts the origin and asks for customs forms to prove it. But instead of getting an answer, he gets threatened. Another similar incident happened in late February. Guangxi netizens ordered 4,000 masks online. When they arrived, they saw the masks were from the Wuhan Federation of Trade Unions. When they examined further, the boxes were still labeled aid supplies. There's also the case of boxes of masks donated to Wuhan from Indonesia. The same boxes were then seen in another city in the same packaging. Later they were bought and donated by a middle school student to the Lijiang Red Cross. These incidents raise questions about the origin of those supplies. Since the CCP virus outbreak in Wuhan, Chinese Americans and organizations have been donating masks to the epicenter. After the pandemic went global, masks were in short supply in many countries. A video obtained by our sister media Epoch Times shows boxes of masks at a post office in Wuhan. The video was posted on February 1st, when the outbreak in Wuhan was severe. The man in the video says, "This is only 1/10 of all its masks," and added, "Look, everyone, these are what we've received." A video posted on January 31st shows people not allowed to claim their packages at what they call a post office in Wuhan. Netizens speculated that the CCP was keeping and selling the masks themselves. They criticized the regime for its action, adding that this can only happen under the CCP. Reporting by Shuan Rong, NTD News.
A Chinese doctor recounts seeing how an old man was murdered by an unjust healthcare system. NTD Xiaohua Gu has more.
Dr. Liu said he witnessed another doctor murdering a patient inside ICU. The doctor injected drugs that caused the patient's death.
A while after the injection, the old man's body started trembling.
The patient was a man in his 80s. He was sent to the intensive care unit where Liu was an intern. To protect Dr. Liu's identity, we've hidden his name and altered his voice.
He had respiratory failure and slight heart failure. He wasn't an urgent patient sent by an ambulance. He still could have recovered.
ICU treatment is costly. After 4 or 5 days, the man had over $7,000 to pay. The problem was he couldn't afford it.
The hospital wouldn't shoulder the cost, but doctors, nurses, and all staff in the intensive care unit have to. The hospitals wouldn't spend a penny. The system just works like that. You may not be familiar with it. Usually the Bureau of Civil Affairs should pay for it, but they refuse because this old man has children. The children don't want him to be treated. They said, "We're working in other regions. We won't be back, and the hospital can decide what to do with him."
Liu said the old man was sent to the hospital from a nursing home that didn't want the man to die under their care. Many people in China don't have medical insurance.
The nursing home doesn't want to shoulder the responsibility, so of course they will send him to the ICU. The nursing home also wouldn't pay his costs. Medical care in China isn't free. You pay for yourself.
Liu said he remembers it was a morning in early January. He saw the deputy chief of ICU injecting drugs into the old man's body. He thought the deputy chief was trying to save the man from dying, but he didn't see any emergency care equipment. He questioned other staff about what the deputy chief was doing.
At the time, all the doctors and nurses in the ICU were pretending to be busy with their own work. They knew what was happening, they just didn't say anything.
Other patients in the ICU were in comas. Liu then asked a stretcher bearer why the deputy chief was doing emergency care by himself.
The stretcher bearer told me not to care about it and just mind my own business.
Liu said a while after the injection, the man started trembling.
Because he was injected with very powerful respiratory stimulants that are undiluted, he started to have quick and shallow breaths.
Liu then saw that it was potassium chloride and lobeline that was injected. He says potassium chloride can induce cardiac failure. The deputy chief noticed Liu watching and asked him to remove the man's breathing tube.
Basically, he means if you reveal anything about this, then you will be held responsible as well. He asked me to remove the tracheal intubation, so I would be the one that ended the man's life. I was forced to do this. I've been very depressed about it.
Liu says what he saw isn't a standalone incident. It's common and still happens.
Widowed seniors, those without children or whose children work in other regions, after their situation worsens and they're sent to the ICU, if the children don't submit the fee in time, the elderly are secretly killed.
He said in the Chinese healthcare system, hospitals have to make a profit. The earned money then goes to the county-level finance bureau. If the hospital doesn't make money, then management's jobs are on the line. Doctors and nurses have to pay for medical costs if patients don't. He said the situation is cruel and very real. He said the man's death was caused by the healthcare system. Reporting by Xiaohua Gu, NTD News.
Secretary of State Mike Pompeo met with G7 leaders by teleconference today. Combating the CCP virus was top of the agenda. Pompeo saying the U.S. was already sending medical supplies to France and Italy.
Combating the CCP virus was top of the agenda at a meeting of the G7 countries today. Secretary of State Pompeo confirming the U.S. is sending excess medical supplies to France and Italy. The G7 also discussed the Chinese Communist Party's disinformation campaign around the origin of the virus.
There was a lot of discussion today amongst the G7 about the intentional disinformation campaign that China has been and continues to be engaged in. You see it in social media. You see it in remarks from senior people inside the Chinese Communist Party talking about whether this was a U.S. brought to China. I mean, this is crazy talk. And every member of the G7 today saw that this is disinformation campaign.
When asked if the U.S. was still willing to cooperate with the regime, Pompeo said the U.S. has always been ready to do so. The U.S. offered to send scientists and experts to Wuhan when the CCP virus was first discovered.
But we weren't able to do that. The Chinese Communist Party wouldn't permit that to happen.
Pompeo said that instead of cooperating on the virus, the CCP actually withheld information about it. Experts say the cover-up cost the world months of preparations. When asked if Congress would seek compensation from the CCP, Pompeo didn't rule it out, but said that now is a time for saving lives.
But there'll be a right time after we've managed to address this crisis, after we've managed to get these economies back on their feet. There'll be a time for the world to evaluate responsibility for what took place. Thank you all very much.
Negative interest rates come to the U.S. for the first time as investors choose safe investments in an uncertain market. This despite the Dow Jones up over 1,000 points today as Washington reaches a deal on the $2 trillion stimulus package.
Stock markets in the U.S. continuing to climb from the previous session with the Dow Jones up nearly 500 points as of Wednesday afternoon. It comes as the White House and Senate reach a deal on the $2 trillion stimulus package. But some U.S. Treasury bonds now have a negative interest rate for the first time in years, signaling a high demand for safe investments in an uncertain market. And in rural areas, farmers now making farm-to-door deliveries as customers isolate themselves and are frustrated by empty shelves in stores.
We have an immune-compromised child now, and so we are choosing not to do the farmers market. Instead, we're doing a full, just direct porch delivery service through an online storefront that we've made public.
Farmers in Oklahoma delivering products straight to customers' doorsteps with no face-to-face interaction, especially in rural areas where services like Amazon Fresh aren't available. And Amazon being hit hard as workers at 10 facilities test positive for the virus. The company reports an employee at its Staten Island fulfillment center tested positive, with other positive cases in 7 states, including California and Texas. Amazon has closed some sites, but has mostly stayed in operation. And at FedEx Field Stadium in Maryland, where the Washington Redskins football team plays, the National Guard is setting up a testing site. Tents are being set up in the parking lot where residents can be tested. Local media reports the site will be operational this week.
The stalemate is finally over on Capitol Hill. After days of debate between senators and the White House, a deal has been struck for a $2 trillion stimulus package. The Senate is now preparing to vote on one of the most expensive and far-reaching deals ever considered by Congress.
To all Americans, I say, help is on the way, big help and quick help.
A big bipartisan moment on Wednesday in Washington, D.C.
At last, we have a deal.
This agreement is really an outstanding agreement.
It's the largest emergency aid package in U.S. history, worth $2 trillion. We're still waiting for the full details, but so far an earlier draft set aside $250 billion for direct cash payments. That means checks of up to $1,200 for individuals, $2,400 for married couples, and $500 per child. But those numbers could be reduced if an individual makes more than $7,500 a year or a couple makes more than $150,000.
But what we're trying to do right now is just to make as many families and workers whole so they can pay their bills, so they can put food on the table.
The rest of the breakdown includes $350 billion in small business loans, $250 billion in unemployment benefits, and $500 billion in loans for distressed companies. The Senate Majority Leader described it as a wartime level of investment for our nation. The agreement comes after days of back and forth over how best to address the virus-ravaged U.S. economy. In addition to the financial boost, the bill also aims to bring in more protective and life-saving medical gear.
It's good news for the doctors and nurses in emergency rooms around the country who are waiting for more masks and more funding.
After its time in the Senate, the bill will be sent to the House for a vote, and if passed, to the president's desk for signing.
And Governor Cuomo said today that the federal government has to prioritize the resources as New York State needs more beds for the apex.
There are now more virus cases in New York than the next 5 states combined. Governor Andrew Cuomo insisting that it will need more hospital beds as soon as possible.
We may need 140,000. We have 53,000. That's the existing capacity of hospitals. We've told all hospitals they have to increase their capacity by 50%.
Another challenge are ventilators. New York has 4,000 at the moment, but will need 30,000.
We have purchased 7,000, and we are still shopping. Federal government has sent 4,000. We're exploring splitting, where one ventilator could do 2 patients. Italy has had to do this.
Automakers like Ford and General Motors have also agreed to start producing ventilators. In California, half of the first 2,100 cases are between 18 and 49 years old. Governor Gavin Newsom reminding the younger generation to be careful.
And while President Trump is hopeful, residents in New York might not be so. They're facing the highest risk of infection across the nation, and some are still leaving the city, risking outbreaks in new areas.
But to everyone who has left New York over the last few days, because of the rate of the number of cases, you may have been exposed before you left New York.
White House officials say any person who has left New York City and the New York metro area should self-quarantine for 14 days. In the U.S., New York City dwellers bear the highest risk of catching the CCP virus that started in Wuhan, China. White House Coronavirus Response Coordinator Dr. Debbie Birx said 60% of all new cases are coming out of the metro New York area. This means anyone leaving the area may well be carrying the infection.
The idea, if you look at the statistics, it's disturbing. About 1 per 1,000 of these individuals are infected. That's about 8 to 10 times more than in other areas.
Dr. Birx said new cases were popping up on Long Island and elsewhere. Dr. Fauci recommended these people monitor their own state of health and see a physician if necessary. Dr. Birx said it's critical to observe the rules about quarantine so you don't pass the infection on to others, beginning a new cluster of cases. The 14-day self-quarantine period begins from the day of leaving New York. White House officials said the situation in New York is deeply concerning. The New York metro area accounts for almost a third of all U.S. deaths from the virus.
And there are severe blood shortages across the country as blood drives are canceled due to the fast-spreading virus. In California, the American Red Cross is urging citizens to donate during the outbreak.
21-year-old Mason Ekbali rushed to a location in Los Angeles when he heard about the shortage.
I'm a first-time donor in this in what's going on with the COVID-19, and I think that's very important because, again, many of the blood drives have to get canceled because of the virus, and many people are probably afraid to come out and donate in this time period, but I think, again, you're in a safe environment.
26-year-old Blaise Lampugnali urged anyone feeling well enough to come out and donate.
There will be people who need it, and it will get used, so there's it can feel tough to feel cramped inside maybe, or feel like you're not able to contribute. This is definitely a way to do it.
According to the American Red Cross, the coronavirus, or the CCP virus, is not transmissible via transfusion. Roberto Torres, a spokesperson of the organization, emphasized that they're taking all necessary steps to ensure donating blood during the pandemic is safe.
We want to make sure that people know that donating blood is very safe. Even if people don't know if they have the virus or not, we have to check you to make sure your temperature is okay to donate, that you're safe to donate, that you're in good health.
Inside the blood drives, nurses take precautions like cleaning hands and beds and changing their gloves before and after each donor.
And if you would like to donate, you need to make an appointment on the Red Cross website or by calling 1-800-RED-CROSS. And Spain is getting hit harder by the CCP virus as their infection numbers go up and high-ranking officials are getting infected.
Spain experienced the steepest increase in its death toll since the outbreak hit the country. It reported more than 700 deaths in 24 hours. The country's deputy prime minister also tested positive for the CCP virus. The Prime Minister's office said she was doing well and receiving medical treatment. And in Britain, Prince Charles has tested positive as well. He has been displaying mild symptoms, but otherwise remains in good health. It's not possible to say where the Prince of Wales has caught the virus due to the engagements he carries out in his public role. And on a lighter note, Easter Sunday is just around the corner. A bakery in Switzerland decided to take a page out of a safety measures playbook as a way to brighten the mood, dressing up their chocolate Easter bunnies with protective masks.
New emergency legislation in the UK includes enforcement measures never seen before during peacetime. It's expected to be signed into law this week, but the government says it will only use them when necessary. Jane Werrell has the story.
The UK is adopting stricter measures in an effort to stop the spread of COVID-19, the disease caused by the CCP virus. New legislation has been rushed through Parliament as the UK follows the footsteps of its European neighbours. Parliament itself is to close for at least 4 weeks. The UK is already under lockdown, but the new legislation that is 320 pages long gives power to the police to break up gatherings, as well as isolate or detain anyone they think may be at risk of carrying the virus. On Tuesday, police shut down a gathering of around 20 people having a cookout. Other measures in the emergency law will allow workers to claim sick pay more quickly. The legislation shows just how serious the UK government thinks things might get. The chair for the Police Federation of England and Wales said they will do what they can to protect the public, but admitted that the practicalities of police in the lockdown came with challenges. He's asked for the public's support at this time of crisis. Jane Werrell, NTD News, London.
Governors across the country are issuing stay-at-home orders to combat the rising cases of CCP virus in the U.S. It's a cause of stress for many Americans as they adapt to the new measures, but an expert says meditation could help with that. NTD's Kevin Hogan has more.
Nearly half of Americans being asked to stay home amid the outbreak. Lack of control and a fear of the unknown can be a source of stress for many, but meditation coach Lynn Goldberg says meditation can help.
When we actually start to meditate, we recognize that, yes, fear is present, and it is an emotion that we all deal with from time to time, but we learn to sit with it rather than allow it to overwhelm us.
With several states issuing stay-at-home orders, Americans spending more time cooped up at home. Goldberg saying this can cause people to feel trapped and anxious, but meditation can help us respond rather than react.
We're actually completely safe. And we are much more open, and instead of feeling that we need to protect ourselves, we can listen with a much more open heart, and we can communicate with our loved ones in a much calmer, more rational way.
Goldberg saying this is a great time to take up hobbies that we just haven't had time for.
Being really gentle with yourself right now, really, truly going easy on yourself and doing as much as you can to make this less hard in whatever way you possibly can.
A few New Yorkers finding sleep, exercise, and cutting back on too much news good ways to de-stress.
Because with everything blooming and the sun out, you can't be stressed, right?
If I pay too much attention to every little development, it sort of raises my anxiety level.
I'm touching wood, crossing my fingers, and wash my hands. That's what I do.
The meditation coach says if you have the chance, you should go outside. Feeling the air on your skin, smelling that spring is around the corner, and seeing beautiful flowers coming up are all a wonderful therapy for yourself. But she says you just have to be mindful to keep your distance and avoid crowds of people. Reporting from New York, Kevin Hogan, NTD News.
While U.S. Congress deliberated on Tuesday, a few miles north of the Capitol building, members of the USA Canoe and Kayak team were coming to terms with disappointing news that Tokyo 2020 has been postponed.
The Great Falls area is a hotbed for U.S. paddling, and the national team was out on the water despite the International Olympic Committee's announcement. Tyler Euthus, the USA's #2 ranked kayaker, said he felt the committee had no choice but to put off the games until next year.
Everybody's been putting their heart into this for the past year, and a lot of people, their dreams are coming to fruition, and this is going to be their chance. But I think everybody understands, this is just so much bigger than any of us or our sport.
Aaron Mann, the team's communications manager, said there was uncertainty now about the team's financial support from the U.S. Olympic Committee.
So they'll have to determine their budgets and figure out what they're able to put out, and hopefully we'll be in a position where we won't have to worry about that.
Joshua Joseph, who started kayaking at age 6 and has won 2 IFC Junior World Championships, looked ahead to 2021.
I think the dream never dies, and so although you have another year to push, it's just another year to get better and go even harder at it.
The USA Olympic trials were to be held this spring in Oklahoma City.
Here at China in Focus, we bring you first-hand information from inside China. Don't forget to subscribe for the latest updates.